Hi, everybody. This is Yvonne DiVita from the PurinaCare Blog for PurinaCare Pet Insurance, a new series called the Interesting Claims Podcast with Dr. Bill Craig and Dr. Larry McDaniel. And we're going to talk about some claims that have come into PurinaCare. Dr. Bill and Dr. Larry, take it away.
All right, Yvonne, today we've got another interesting case, and it involves another young dog. And as we left off last time talking about Bo the Lab, it's another example of why you want to consider insuring your dog when they're young. Actually, in the first year, there can be a number of issues, a number of problems like we're going to discuss today. And it is a great time to insure your animal as opposed to waiting until later, because puppyhood is, as we can see, is fraught with problems. So, Bill, tell us a little bit about this golden retriever.
Well, this is a 1-year-old female golden retriever named Bailey. Those of you who are familiar with golden retrievers know that they're really friendly, lovable, 80-pound lap dogs. They're very people-oriented. They like kids. Kind of like Bo, life's a party for a dog like Bailey. And Bailey's owner called the veterinarian back in January because Bailey had been vomiting for a couple of days. And in the last time that she vomited, she threw up the black sole of a pair of sneakers. And so they had Bailey come in to the veterinarian, and they examined Bailey. The owner thinks that Bailey's having normal stools, or is having normal stools. And they think that she ate part of a sock and an insert from a size 12 sneaker.
Oh, my word.
And some of that, believe it or not, passed in the stool, but not the entire insert from the shoe. So they were worried about that. They examined Bailey. They took some x-rays, didn't really see anything diagnostic on the examination, so they decided that they were going to put Bailey on some medication to maybe help move things through the intestinal tract and hopefully dodge the bullet on getting this problem resolved. Well, the next day, the owner has called to give a status report and makes the comment that one of Bailey's leashes is missing. They can't find the leash, and she says that she's missing one of her bras and thinks that Bailey got into the dryer. So Bailey has an interesting dietary selections here.
Oh, my God.
I'm wondering if you might not see the little metal straps on a bra in the dog's intestine.
Well, that didn't show up, and I think when we get to the rest of the story, we'll find out that maybe the bra wasn't the offending article. They decided, they had a discussion with Bailey's owners that after this vomiting had gone on for 24 or 48 hours, that, okay, this is not going to take care of itself. We got to talk about the potential of doing some sort of procedure to remove this. And the options that were discussed, one would be to do a gastroscopy or endoscopy, in which a fiber optic instrument is passed down through the mouth into the stomach, and if the foreign object is still in the stomach, it could possibly be grasped by instruments with the fiber optic scope and pulled back out. That obviously is a much easier procedure in terms of the patient because there's no surgery to recover from. But unfortunately, in cases like this, where we might have a fabric article that may have already been passed from the stomach into the intestine, that's not always an easy procedure to do. It's difficult to grasp something that large and pull it back out. So the other option was to refer Bailey to a surgeon for what's called an exploratory laparotomy. And this is medical terminology for let's cut her belly open and go look inside and see what we can find. So in Bailey's situation, the decision was made to refer her for a surgical procedure. They performed the laparotomy and did an enterotomy and gastrotomy, which means that the stomach itself, the organ, is open and you look inside, and you open areas of the intestine to locate and remove. In this particular case, it was Bailey's leash. So one of the problems with an object like the leash, which we would refer to as a linear foreign body. So that means that it's a long, skinny thing, and frequently a piece of string can be a linear foreign body, particularly with cats. That linear foreign body gets strung out along the length of the intestine, and it can't move because one part of the intestine may be contracting and holding it while another part of the intestine is trying to move it on through. So
it also becomes a real surgical problem to remove it, a linear foreign body, safely without, it's not like you can just start grabbing and pulling, because you can seriously damage the lining of the intestinal tract doing something like that.
Right, and frequently the procedure involves making several incisions into the intestinal tract and cutting the linear foreign body into pieces and removing it one section at a time. Right. But in this particular case, the surgeon was able to get Bailey's foreign body removed, and everybody was happy. Bailey healed up just fine, and I guess they're cleaning up around the house a little more effectively now so that Bailey doesn't have quite as many opportunities to scarf up socks, shoe inserts, leashes, and brassieres.
Yeah, it's funny that young dogs, typically foreign body problems are in young dogs because they haven't quite figured out yet what they can get away with swallowing and what they can't get away with swallowing. Hopefully Bailey's learned a bit of a lesson, but I would imagine it was an expensive lesson, eh, Bill?
Well, yeah, if it had been a small object and they were able to use, say, a lubricant-type laxative to get it to move on through, then that would have been a very simple solution. Or even if they had been able to remove it with a gastroscope, then that would be a less expensive procedure. But then when you have to go to a referral center and have the exploratory laparotomy, make several incisions into the digestive tract to retrieve this linear foreign body, then the bill runs on up. And this one was about a $3,000 experience for Bailey. Bailey probably didn't care since she didn't have to pay for it personally. But Bailey's owners, I think, were quite happy to find out that PurinaCare ended up reimbursing about $2,500 of that cost.
Wow, that's another great example of the value of insuring them when they're young and when they typically run into these types of puppyhood problems.
Right, and puppies and kittens very rarely have any kind of pre-existing issues, so that's the best time to insure them. And then as they get older and develop either developmental problems or, in this particular case, just get into trouble, then you've got the insurance coverage there to help you out on the financial part of it.
Well, great, Bill. Well, we look forward to discussing other interesting cases next week. Thanks for your time, and keep those interesting cases coming.
Unfortunately, the pets of America, there's no end to the things that they, kind of problems they get into, so we've always got interesting cases to talk about.
Yeah,
all right,
excellent.
Thanks a lot, Bill.
I want to thank both of you, and we hope everyone will tune in next week to our next session of Interesting Claims at the PurinaCare Blog. Thanks, Dr. Larry and Dr. Bill.
Thank you.